Boston Light, America's oldest lighthouse, has stood strong through every dark hour and bright dawn our country has endured. It has seen the break in the clouds before anyone else. For the past 168 years, we've also stood by you, helping you weather storms like this one, to protect your loved ones. And we'll do it for 168 more.
Thank you to everyone for joining us today in what no longer seems like that unusual a forum, though I long for the day when Zoom just means going fast again. My name is Brian McGrory. I'm the editor of the Boston Globe, and we're really excited to be joined by a pair of prominent guests on the front lines of this crisis. Peter Slavin, the longtime president of Massachusetts General Hospital, and Marty Walsh, the second-term mayor of Boston. Dr. Slavin certainly shook up the region and the nation when he said on Meet the Press in mid-March that we need to think about this coronavirus crisis in an almost warlike stance. That quote certainly got everyone's attention. Ever since, Mass General has been, not surprisingly, at the forefront of treating COVID-19 patients, advocating for more and better equipment for healthcare workers there and elsewhere, and cutting a path toward a more effective long-term treatment with trials and research. Mayor Walsh has earned widespread praise for facing this crisis with a guiding sense of determination, practicality, and compassion. He has approached this battle with his trademark mantra that has served him well throughout so much of his life. Let's take things one day at a time. The mayor has been vocal and decisive, scolding some Bostonians when they're not doing what needs to be done, but also praising and supporting the hundreds of thousands of people who are performing their very best. The panel will be moderated by the Globe's elite business reporter, Janelle Nanos. Before I turn it over to Janelle, I'd like to thank everyone who is watching this event today. Strong journalism is vital to the civic health of a community on ordinary days, but especially so in the throes of a once-in-a-lifetime public health and economic crisis. At the Globe, we have seen not just record readership, but readership that was previously unfathomable. Our journalists are working remotely on the sprawling story morning and night, providing insight and lending expertise in terms of public health, the economy, and government, always with the charge to report in a humane and empathetic way. Good journalism is, very bluntly, an expensive proposition. If you're a subscriber, thank you sincerely. You're part of our mission. If you're not, please think about becoming one today. And to that end, our sincere thanks to Roger Crandall, the CEO of MassMutual. The storied company, long an integral part of the Massachusetts business community, is lending its support to this event today and to the Globe in general at a very vital time. With that, I'll turn it over to Roger.
Thank you very much, Brian. Good afternoon, everybody, and thank you for joining us today. On behalf of MassMutual, I'd like to welcome everybody to today's discussion. Obviously, we've never seen something in our lifetimes like the COVID-19 pandemic and the toll that it's taking on our communities and loved ones. At MassMutual, we think it's critical to hear directly from experts and leaders. And the leadership and expertise we have in our Commonwealth is extraordinary. So I want to thank both Dr. Slavin and the mayor for participating on the panel today. As Brian said, the role of the press is especially important in times like these. So thank you, Brian and Janelle and everyone at the Globe for everything that you're doing to keep people informed and telling the stories of the people who've been impacted by the disease. Mayor Walsh, thank you for the leadership of the city during this time and the steps you've taken to keep our residents safe and healthy, and especially your focus on all the residents of the city. Your task force to address racial disparities with infections and making sure that testing is available to the broader population will save lives. Our approach in Boston and Massachusetts as a whole shows how government leaders can work together in a bipartisan way, and your strong working relationships with the federal officials, state leaders, including Governor Baker, and other local officials like Mayor Sarno here in Springfield are shining examples of that effort. And finally, Dr. Slavin, I think I speak for everyone when I say how incredible lucky we are to have you and access to the extraordinary medical and scientific community at Mass General, and particularly the amazing and inspiring frontline staff who are working so hard and sacrificing so much to take care of those with COVID-19. Thank you to all that you're doing. When you see their stories, from the doctors and nurses to the respiratory therapists to the EMTs and everybody at the hospital, it's prompted us to wonder what we can do to help. And so I'm very pleased to let everybody know that MassMutual last week launched a free life insurance program called HealthBridge. We are providing $3 billion of free term life insurance coverage to eligible healthcare workers who are helping in the fight against COVID-19 in Massachusetts and Connecticut. So please help get the word out as we are taking applications and issuing policies today. Please go to massmutual.com and sign up for one of these policies. If you or a loved one or a family member are on the front lines of this crisis, we can never repay you for all your work, but we'd be honored to protect you. So now I'll turn it over to Janelle, who is going to moderate the panelists. Thank you very much.
Thank you so much, Roger, and thank you, Brian, and thanks to all of you watching at home. I'm at home as well, and I'm really looking forward to having the conversation with Mayor Walsh and with Dr. Slavin. If you'd like to both join us now, that would be great. Thank you both. For those of you watching at home, you'll notice that there's a Q&A box on the bottom of the screen. That box is there for you to input questions. We'll be taking questions as we go through this panel today, so please submit them. We've also received hundreds of questions from readers, and I've been going through them over the last day or so, and I'm going to try and get to as many as we can. This is being live streamed on Zoom and on Facebook, but if you are not able to log in, you can watch this. We'll be recording this and posting it on the Globe's website. Thank you so much, Mayor Walsh and Dr. Slavin, for joining us. We're so glad to have you here and for your leadership in this time of crisis. One could argue that the city has in some ways turned a corner at some point. Mass General noted earlier this week that its own models show that the curve is flattening. However, the state had its highest single-day death toll yesterday. I'm guessing neither of you has had much sleep lately. So what's the one big thing that will need to happen in order for our region, in our region, before either of you is able to rest easy again?
You want me to?
Mayor Walsh. Yeah.
Thank you. First of all, thank you, Janelle. Thank you, Boston Globe, Brian McGrory and Roger Crandall for sponsoring, and Brian for your leadership here during this very difficult time. I want to thank the Globe for their coverage. A lot of information that's being put out there, and it's accurate, and I want to thank you for that. I think for me, the one thing that's keeping me up now, as far as returning back to some type of normalcy, is really the ability for testing capacity and tracing. I think that, and Dr. Slavin will have a lot more to say about this, I know, as a medical expert, but I think that, we need data to see how we open, when we open, what segments we open, what populations are still going to be vulnerable, what populations are a little less vulnerable. All of those different pieces, it's right now, it's about information. When we closed everything down, at the time, it seemed like a very difficult decision, but it was based on keeping people safe and, quite honestly, not understanding the magnitude of trying to keep people alive. Going back is going to be a whole different situation, because the coronavirus, for all intents and purposes, is still going to be very much alive and very much front and center, whether it's a month from now, 2 months from now, even 3 months from now. So for me, it's data and testing, and I think Dr. Slavin will probably have a more educated answer on it.
Dr. Slavin, what do you think we'll need in order for you to rest easy again?
I think we are going to have to just sort of follow the lead of this virus. We have not encountered this virus before in our lifetimes. We've seen similar ones in the past, but I think we just need to watch very carefully how this virus is behaving, affecting our population, and respond accordingly. Let our political views get in the way. We can't let our hopes and dreams we just do in a very scientific, analytic way, see how this virus is affecting our population and respond as a society accordingly.
I'm curious what it will look like as we start to head back and open up things again. Do you have a sense that we're going to need to be doing things like temperature checks or antibody screening in order for people to return to the office or their workplace? What sort of protocols are you thinking about rolling out, Mayor Walsh, and what do you think will be most effective in order to keep people safe and healthy?
Well, I think, when we think about opening up society, and obviously, let me just start by thanking everyone that's watching today. And the answers that we have today literally could be very different tomorrow. And what I'm going to try and do is talk in general terms so everyone understands this virus is unpredictable. and it's caused obviously a lot of heartache and havoc in our society. And it's not just here in Boston and Massachusetts, but the entire world. And when I start to think about when we go back to work, what does it look like? We're focusing on our building here. I'm in City Hall today, and thinking about my workforce and our workforce here, and how do we, once we decide to, once things start to go back, what does that mean? And we're exploring different options, and we want to come up with some policies right now in City Hall. If you come into City Hall today, we're open 2 days a week. You need an appointment, you're going to have your temperature tested. If you are an employee who works in this building, you're having your temperature taken. So that's the first kind of line of precaution that we have. We're still going to have a lot of scheduling by appointments. We're looking at how do we bring back our workforce? Do we bring them back in shifts so that the entire building is not full of people? What do we do with our older population, our more vulnerable population? Do we make sure there's opportunities to still work from home for those folks that are over 65 years old, or 62 to 65, or people with pre-existing health conditions that have to go to work still? So we're walking through systematically all these different areas of how this happens. We're also working with, I had a conference the other day, a phone call with the colleges in the Boston area. And we talked about what does that look like? And again, it has to be a very systematic approach where we're very cognizant and think of everything we need to think of. And I think, again, it goes back, not to repeat myself, but I think I will a lot today. It goes back to the data. What does the data say? And having that information that is so important for how do we go back to society. Anyone watching thinking that, there's going to be a date in the future, whatever date that is, sometime in June or July and August, we're going to return back to the way it was February 28th. Well, that's not going to happen, at least for the foreseeable future. We're going to be living in a different normal here in America, and in Boston, certainly in Massachusetts. But it is vitally important as we think about this that we get it right when we start to reopen, because what we have to be anticipating is a second surge. And I don't think we can afford to shut society down like we have for the last almost 2 months. I really think we have to be cognizant of that. And it's going to take a lot of smart people and a lot of people thinking about how do we do this, as well as working with our medical professionals. We spent a lot of time over the course of the last, month here to try and keep capacity down in hospitals, meaning that they're not overloaded with COVID patients. We built Boston Hope over at the BCEC. We set up a system in place to create 1,000 beds for our homeless population. All of that was to protect people, but all of that also is to allow great hospitals like Mass General and BI and Brigham and all the hospitals we have in the city of Boston, quite honestly, can still treat people that have COVID, but also still treat people that are sick, because sickness doesn't stop because of coronavirus. So people still need to go in for other things.
Great. Dr. Slavin, what do you see as being an indicator that things will return to normal? How will we ensure that we're not going to continue to put people at risk? And how will that stress the healthcare system? I mean, in terms of testing, how often will people need to be tested? How will antibody tests work if they're out there? How do you see this working as we go forward to ensure that there isn't a continued spread?
Well, the good news is that it does appear that our state is nearing or at the peak of the curve of this particular wave of COVID-2. And so hopefully we will start descending in that curve very, very soon. And hopefully, we don't know if it'll be a shallow curve or a steep curve. As I said earlier, we just need to follow the numbers and respect this very infectious and deadly virus. I agree with the mayor that things are not going to return to normal all at once. We're going to have to ease our way into it, because I think if we move too quickly, as a few countries have around the world, we could easily spark a new wave that could be even bigger than the one we're in the midst of right now. It's important to remember that although 840,000 people around this country have been confirmed to have COVID-19, and 43,000 here in Massachusetts, that still represents a tiny percentage of the population, 0.3% nationally, 0.6% within our state. And in all likelihood, the number of people who have been exposed is much higher than that, because some people with this disease are asymptomatic, others have not gotten tested despite symptoms. So the estimates of how many people have actually been exposed has ranged anywhere from 1% to 30%. But we're going to need to get to 60 to 70% in order to achieve herd immunity. And how we're going to get there without, as of yet, an effective treatment or a vaccine is going to be very tricky. As we begin to open up society, there will be sparks, there will be outbreaks that we need to jump on as quickly as we possibly can. And we need to use a lot of testing in order to be able to do that. And I hope the testing resources that we're going to need will be there. So it is going to be a very delicate dance that we do with this virus over the coming months. And I think that we just need to be as careful, cautious as possible, because the last thing we want to do is spark a much bigger wave that could kill many more people in this country than has already happened and overwhelm our healthcare system. As I said, this wave, which has involved 0.3 to 0.6%, has caused the healthcare system to bend dramatically, fortunately not to break, but a much bigger wave could completely overwhelm us.
Dr. Slavin, you mentioned vaccine and treatments. Do you have a sense, do you anticipate one coming before the other? And what role that Boston institutions might have in developing and testing these vaccines or treatments right now?
I think that I'm more hopeful that there will be a treatment on the horizon, some kind of drug therapy in advance of a vaccine. Typically, vaccines take 12 to 18 months, if not longer, to develop. There are a number of promising drugs that are being trialed at our hospital and hospitals around the country and around the world. And we certainly have our fingers crossed that one of those drugs, sooner rather than later, will prove to be effective. I think we should be very proud of the fact that two of the major vaccine candidates, one coming out of Moderna and the other coming out of the Beth Israel and the Reagan Institute, have been heavily invested in by our federal government. In the case of the Reagan Institute, which is part of Mass General, and the Beth Israel vaccine, that the government has agreed to invest $1 billion. They're going to start building a production plant even in advance of the trials for this vaccine being done. So I think the fact that, Boston is the epicenter of biomedical research in this country and the world. A disproportionate number of these drugs, vaccines, other ideas to contain this will come out of this community.
Speaking of community, I wanted to ask you, Mayor Walsh, how can you assess how the city's residents have been responding to your call for social distancing? And do you anticipate that you'll need to put any further restrictions in place or fines or other methods along those lines to ensure that people stay home and stay safe?
I think the majority of the people are doing their part by physical social distancing, by, if they go for a walk, staying 6 feet apart from each other. Only going out for essential items. I think I'd certainly like to see more people wearing face coverings or masks. I probably see in the course of a day, maybe 50% of the people that are out wearing it, particularly when you go in stores and you're going into pharmacies. The workers that are in there are frontline workers, and they want to be safe and remain safe. And so we would ask people to wear them when you go in, even putting a t-shirt around your face, simply as putting a t-shirt around your face. It's maybe frustrating is the wrong word, but it's concerning when I see large groups of people gathering, particularly over the last 2 weeks. We've had 2 nice days. And in those days, we've had people gathering in parks. And when you're going for a walk, it's normal to stop and socialize. It's just a normal function that we do. But we're asking people not to do that here. Maybe wave and keep walking. We saw people last weekend on the golf course in Franklin Park, and a lot of people had comments on, why can't you golf? Well, we're trying to prevent any type of socializing right now as we move forward here, because what we want to do is stop the spread of the virus. I certainly don't want to go into, I'm asked that question a lot, are you going to fine people? And New York's fining people. I don't know if they're consistently fining people, but they did write some tickets. That shouldn't be resources we're wasting from our public safety officials to write a ticket because you're gathering in parks. We need people to be very vigilant on this. This is going to, we're talking for at least the stay-at-home orders in place till May 4th. And I'm expecting probably that'll be expanded because it's been expanded in other cities and states, or other states around the country. So we're probably in for another 4, 5, 6 weeks of what we're living with today. as far as stopping and spreading the virus. And at the end of the day, that it's incumbent upon all of us as individuals, as Bostonians, as Massachusetts, as Americans, to do everything we can to stop the spread of the virus. You're keeping your families healthy, and you're keeping your family safe by doing this. And Dr. Slavin just alluded to the fact that we don't know if there's a second surge, what type of virus is going to come back. It'll be coronavirus, but there's, is it going to be more serious? Are we going to lose more people? We've lost 45,000 plus Americans right now due to the coronavirus. In Boston, we've lost 221 people in the city of Boston as of last night. Yesterday, thousands in the state. This is a serious virus, so I'm asking people to pay attention and do what they need to do to keep their family safe.
Dr. Slavin, I wanted to turn to you and get your perspective on how you're keeping your healthcare workers safe and where things stand in terms of access to PPE. I know there's obviously some tools being used now to decontaminate masks. How is that working? There's been a lot of questions from readers about how safe are workers and what is being done to ensure that they're going to be able to maintain that safety as things progress.
Fortunately, we've been able to provide adequate PPE to our staff throughout this entire period and are reasonably confident going forward. Early on during this crisis, it was the N95 masks, the masks that are used when our staff are in direct contact with patients with COVID, that we were worried about running short of. And fortunately, due to that shipment from China that the governor and Jonathan Kraft arranged, thanks to this Battelle Decontamination Center in Somerville, which is now decontaminating our N95 masks for use by our staff. The N95 picture, I think, has gotten a lot brighter. The piece of PPE that we're most worried about at the moment across the state are the gowns that our staff wear when they go into patients to see patients. Those are in short supply. My understanding is that there are some institutions that are on the verge of running out of them. And so that's the type of supply that we're most desperately in need of. And I think the state has arranged for a large shipment of gowns to arrive in the state in the very near future. So we'll probably see all sorts of different kinds of shortages and over the coming months. But at the moment, we're pretty in reasonable shape. We have a very elaborate safety reporting system at Mass General where we ask our staff to highlight safety concerns to us. And I was pleased to see in reviewing the reports from last week that very few people at this point have expressed concern about PPE.
That's great to hear. I mean, one question from a reader that came in is also, what are you doing to mitigate PTSD in frontline caregivers at MGH? And how are you helping with mental health and other support along those lines, because they are going through so much?
No, they certainly are. I mean, these healthcare workers are doing what they normally do every day, taking care of some very sick people. But unlike other situations like the marathon bombing or other crises, they're also putting themselves at some risk as well. We're doing a variety of things to support our staff. One is that on each of our COVID units on a regular basis, we're having rounds where the team meets with social workers, somebody from our chaplain department, to just talk openly about what it's like to take care of these patients and putting themselves in harm's way. We have a very active employee assistance program that is available to anybody who feels like they need support. And then I would have to say that all the support that we receive from outside the institution has been incredibly heartwarming, and I think has lifted the spirits of our staff, be it meals that are being delivered to the hospital, be it clips from people like David Ortiz, and also be it the philanthropy that we've received that has helped us pay for a number of the different activities related to COVID. All those things really buoy the spirits of the staff and are very, very helpful. But there's no doubt that our staff will experience some of the precursors of post-traumatic stress and may need help as healthcare workers around this country, around the world will, for quite a while in the years to come.
Janelle, if I could just jump in here real quickly. About 6 weeks ago, we put together a video with the help of Mass General Hospital from Dr. Larry Ronan and Dr. Steve Durant, who's a psychologist that went to our first responders, kind of what to look for in the cases of in the early days of coronavirus, the symptoms, how to protect you and them and their family, and also the psychological aspect of it as far as what signs to look out for and talk to. And as a matter of fact, this morning, we start our day every day here in City Hall with a call to talk about what's the plan, how did yesterday go, what the plan for tomorrow is. And one of the things we're doing, and it came up on the call, is many of our frontline workers and folks working with our seniors, what they're experiencing is a lot of death. And a lot of folks that they're talking to are feeling that their friends and loved ones are dying. And we're coming together with a little bit of a plan on how to reach out to our own employees and the public, because I mean, I think at this point, a lot of people know somebody either directly or indirectly through one person that has lost their life during this coronavirus. And some people know several, and it has an impact. And in the idea of staying at home, as human beings, we're generally very social. We want to be with people and talk to people, and you know, and that physical connection is important as far as shaking hands and things like that. And for the last 2 months, we haven't had that. So we're starting to think about in here, how do we offer supports to our people here in the city, but also make sure, and I talk about it when I do press conferences, about the need, and people on this Zoom call listening today, if you feel stressed, you know, reach out to an EAP, reach out to somebody. You can call the city of Boston. We have counselors willing to help by calling 311. It's such an important time because it's a very, I mean, most of us haven't gone through anything like this. And you might not feel normal making a call, but if you need help or you want to talk to somebody, you need to make the call for yourself and your family.
It's so great to hear that those services are being offered to everyone in Boston and beyond. So thank you. I have a question now from a young reader named Maribel. I'm in kindergarten. Can I have summer camp this summer? I think a lot of us are all echoing that same question. What is summer going to look like here? We got a lot of questions about, can I have my summer wedding? Things along those lines. You know, what do we anticipate things will look like going forward? And in particular for students, are there going to be opportunities for summer learning if camps aren't open, or will the school year be reimagined in some way to start sooner or to do more, you know, distance learning over the summer to ensure that the achievement gap doesn't widen?
Those are all great questions. And Maribel, thank you for your question. And I hope the answer, I can't give you a yes right now, but I hope the answer is we have some sort of summer camp this year. I still think it's a little too early, but those are all challenges that we're grappling with right now here in the city. What do we do with extended learning? Fifth quarter is a program we have for extended learning. We've grown that program every year for the last several. We have summer camps in places like Camp Harborview, the Ron Burton Training Village, and so many other programs that are out there through our own BCUF centers. Summer job programs. New York City, I think, canceled their summer job programs. I don't want to do that. I want to keep some resemblance of a summer job program, and that might not be as comprehensive as it has been over the last decade here in the city, but I still think it's a little too early. Dr. Slavin spoke earlier about, and we all talked about testing. It really, you know, the capacity of being able to run the test. I think that the city of Boston certainly can set up testing facilities fairly quickly. We have 10 right now that'll be up and running this week through our health centers. We have 5 in our hospitals, and we can expand that pretty quickly. The issue is, where are we going to have the volume of tests needed to do this mass testing? I know that the governor is trying to, and the state is trying to reach out and get tests. We're trying to do it in the city of Boston as well. We're trying to get our hands on tests so we can start testing more people and getting a better gauge on. I think that will help us, guide us in what decisions, what can and can't be open this summer, and the things that can be open. What does that mean? Are we going to have, you know, camps that can run, you know, half the size? Can we open restaurants again? All of that is really going to be fed off of the data that we're talking about. So, Maribel, I hope we have camp for you because it's been a long 2 months without school. It's going to be another 2 months, and when you think about it, by the time September comes around, our kids will have been physically out of a building for 6 months. That's almost that was unimaginable, if you will, having that conversation last year, and here we are today having that conversation.
I know for my sake, I have two small kids at home, so if we could have summer camp, that would be great. Well, just putting that out there. I'm for Dr. Slavin. I'm curious if there's anything that has surprised you medically about this crisis. If you could have prepared in some way, knowing now what you didn't know then, what would you have done differently?
I don't think this is, I mean, this virus and its behavior is certainly a bit of a surprise. We've had other coronavirus infections, most of which are perfectly normal or routine. The coronavirus is a very common cause of the common cold. The two most serious coronaviruses that we've seen in the past were SARS and MERS, both of which were actually more deadly than the virus that we're now dealing with, but they were also much less contagious. So this virus is an unusual combination of being highly contagious, and also being 4 times more deadly than influenza. So I never really expected to see anything like this during my lifetime, but so dealing with the reality of this virus is quite a bit of a shock, and something we all need to get used to. And like I said at the outset, we just can't fool around with this virus, despite our wishes to go to summer camp, despite my wish to play golf. There are certain things that are more important in life than that. I remember my grandmother telling me about the great sacrifices that she made as a child during World War II, and I hope children of this era will have similar stories to tell their kids about how they successfully helped their families, their communities get through this crisis of our lifetime.
In many ways, this crisis has exacerbated and shown us just how difficult it is for some communities to access the healthcare system, and the inequality that exists, and thrown it into sharp contrast. How do you think this virus will impact the way we approach our healthcare delivery systems going forward? That also reaches to the public health too side of things, Mayor Walsh. I'm just really curious in terms of how you think we'll deliver care to those most in need as we move out of this virus.
I think what we did here in the city of Boston, because of the high numbers of people who came in contact with the coronavirus, particularly African American, Latino, and Asian, if you put all 3 groups of people together, it's well over 60+% of the people who got the virus. We put together an equities task force to look at this, to see what the situations are there, and then also making sure that the care, I mean, we've been battling with inequality and equity in healthcare for a long time. We look at higher rates of asthma in Dorchester, Roxbury areas. We're looking at that, and I think this gives us an opportunity to really kind of take a different peek at. I feel that the hospitals are treating everyone the same in this particular case, and people are getting access to hospitals where they need it. But I think that there are lessons to be learned on a system like this, as Dr. Slavin just mentioned. We never expected dealing with a virus like this in our lifetime, and that virus puts a big spotlight on a lot of inequities that we have in our society, not just simply in healthcare, but in economic development, in food access, in housing access, all of those different things that when we come out of this, we really have to do a much better job of solving a lot of those different problems.
Dr. Slavin?
And if I could just add,
Yeah.
I mean, we knew before this crisis began that it's really the social determinants of health that are much more powerful influence on the health of a population than the healthcare that they receive. It's things like poverty, housing conditions, the environment, education, access to high quality food. Those are the things that determine how healthy a population is. And we have seen that in spades during this pandemic. There are lower income communities in this state like Chelsea, Revere, East Boston, that MGH has had longstanding relations with, have been differentially affected by this virus because people live in denser housing conditions. It's harder to do physical distancing. Many people in those communities have to go to work, and they're using public transportation, and given the nature of the work they're doing, it's hard to do physical distancing there as well. So it was, we did some random testing in Chelsea Square just last week and found that 33% of the people, most of whom were asymptomatic, had the disease, and yet in other populations, other populations like in Santa Clara, California, the rate of infection was only 2%. So disadvantaged populations in our society are really taking it on the chin during this pandemic. And I want to congratulate Mayor Walsh, the governor, the attorney general, public leaders. In every conversation I have with them about this pandemic, this issue of equity always comes up, and we and they are doing everything we can to try to counter these forces.
That study in Chelsea was fascinating in terms of the asymptomatic patients. And can you help explain why you think that those numbers were so strikingly high compared to other populations where this testing is now underway, and what that tells us about the virus itself?
Well, that testing was what's called serologic testing, not testing for the virus's RNA.
For the antibodies.
But testing for antibody against the virus. And so we did about 200 people one day in Chelsea Square in Bellingham Square, and as I said, found that about 32% of them had either IgM or IgG antibody in their blood, indicating that they had been previously exposed and were beginning to develop an antibody response to the virus. Again, I think it's because of housing conditions. I think it's because of lack of ability to do physical distancing that makes people who live in communities like Chelsea much more vulnerable than other communities. And there was a fascinating piece that appeared in a different publication that looked at cell phone tracking in different communities, wealthy communities in this country, poorer communities, and found that in wealthy communities, people were physically distancing in their homes, whereas in poorer communities, they were out going to work and putting themselves at risk. So I think that's the fundamental reason why we're seeing what we're seeing.
You mentioned transportation, and I wanted to ask, there's a lot of questions about what it will look like to get back on MBTA and get back to work at some point in time, and what restrictions, safety measures will need to be in place in order for us to use the transit system again. Mayor Walsh, what do those conversations look like right now?
When I had my conversation with the college presidents the other day, that was the main topic of the conversation. Many kids that come to Boston for college live in a neighborhood. They take public transportation to go to school. We have our own kids, 7th through 12th grade. When they go back to school in September, they're going to be taking public transportation. And I think that it's going to be, the experience will have to be different. There'll have to be more frequent service. There'll have to be social distancing going on even in September, because we're still going to have people that are going to be testing positive for the virus. I'm not sure what the numbers will look like by then, but we're obviously going to be worried about a second surge. I think that the cleaning of the common areas is going to have to be very frequent and front and center for people. I know for our own vans and our own buses taking our own kids, right now we have a system in place that we do food delivery services, basically with our school buses and school bus drivers. There's a system in place, a checklist that, every morning the bus has to be cleaned down, the driver has to look at the checklist. We have to make sure that as we deliver the food, when it's done, it's brought back to the yard, it's clean again. We're doing some rides, not many rides for our seniors anymore, but we do have vans that take our seniors, basically almost like a senior shuttle, making sure that those places are clean, that we're wiping down the surfaces. All of that is going to be a very different world than we got into it. When this started, people remember the general manager of the MBTA had crews that were going out cleaning down and cleaning common areas. I think it was twice or three times a day. That was really before the really heart of this virus hit us. It's going to be very different going back, and that's going to be part of our decision when we think about bringing people back to work. What does it look like? How many people are actually going to be coming into Boston every day, traveling? Because a good portion of them take the MBTA, and they're going to have to take the MBTA because they're not going to want to drive into the city and there's no place to park. So I think that we're going to be working with the MBTA now and come up with a plan. I mean, for the most part, I think it's pretty much a skeleton ridership, or it's a very cut back ridership as far as schedule. But as we start to get back to moving forward, moving our economy forward, obviously the ridership is going to increase, and we're going to have to work very closely with the MBTA to make sure, number one, they have the capacity to do what needs to be done, and number two, also making the customers and the residents feel safe that they can take the train again on the bus.
Dr. Slavin, from a healthcare perspective, when do you anticipate that there's a certain threshold reached that we'll be able to reopen non-essential businesses, restaurants, things along those lines? And what protocols do you see needing to be in place in order to roll those businesses back out? Will we have to move restaurant tables 6 feet apart? What safety measures are going to have to be implemented in order to get that gradual revamp up?
I don't think we know at this point how long it's going to take to get there. We don't know if this virus, the number of cases in the community in this country is going to fall off dramatically, going to trail off much more gradually. I think the best estimates are that it's probably more the latter than the former. If you look around the country around the world at other countries that have begun to open up, the ones that waited until the virus was almost non-existent, or where the community transmission was extremely low, have done a lot better than those that started much earlier. So I think we need to be patient and wait for the transmission of this virus within our community to be close to zero. Yes, I think when it comes to things like restaurants and other places where people gather, we're going to have to early on do lots of hand hygiene, lots of social distancing, so that people aren't exposed to one another, or we can minimize that exposure to the greatest degree possible. One of the challenges associated with this virus is that it appears from the day that you contract it to the day that you become symptomatic is about a 5-day period. And during those 5 days, you can be infectious to others. And so that's one of the reasons why this virus is hard to contain, and why it's really important that we wait for it to be almost gone before we start opening up our society very significantly. And I realize that the cost of not opening up society is unfathomable. The economic impact that this is having, the impact that it's having on young children like Mirabelle, it's relatively easy to measure the impact that COVID-19 is having. It's much harder to measure the impact that of our society at nearly a standstill. So we do need to start opening up at some point, but we just need to be very careful, because the last thing we would want would be to precipitate a wave that could dwarf the one that we're currently living through.
Let me just jump in a little bit there. I think people, to understand the magnitude, February 1st was our first case of coronavirus, right around that time. Our second case came around March 4th. Our sixth case came around March 6th. And the week after that, pretty much, we shut society down. From that time, March 6th, till about 2 weeks ago, we were averaging roughly double-digit increases a day in coronavirus cases. For almost the last 14 days, we've been averaging over 200 new positives every single day. And for the foreseeable future, that number is going to stay there, maybe even go up a little bit. We've seen our hospitalization level off a bit, but we've still seen these cases go up. So when people talk about when are we going to open up, I know the time feels like we've been in this forever, and we have been locked down for probably 7 weeks now. But the last 2 weeks has been our largest increases in coronavirus cases. And for the foreseeable next week or two, we're going to continue to see those numbers go up. So I think when people talk about what's it look like going back and when can we go back, we really can't tell, because it really is unpredictable. Now the models are constantly changing, and the doc can probably go into more modeling, what's working, what's not working. What's really working is that our hospital capacity hasn't been over capacity yet, although there's times where some of our hospitals have been full and have been diverting people from the emergency room to other hospitals. But I really think that it's gonna take, and with all of the conversation we're gonna have today and the dialogue after this, it is about patience. And it's about everyone being patient and working with us, because this is about seriousness. This is about keeping us safe. I would love to give everyone the answers. I'm sure there's tons of questions coming in about restaurants, and are we going to see sports this year, and are we going to have the marathon, are we going to do this and this? And I hope the answer to all those is yes. But as of right now, we literally have to take this a day at a time as we move forward here, because it's not a predictive virus. We don't know what the end game is. We don't know when the end date is. We don't know if it's going to be a resurgence. All of those things that are out there. So I just ask people, we have to continue to be patient and vigilant in what we're doing, because it is about keeping people safe and not getting the virus, and also keeping people alive.
Along those lines, I mean, obviously keeping people safe and alive is the utmost importance, but for a lot of people, this is an economic hit. And so many of our small businesses in Boston failed to get federal funding from the CARES Act to keep them afloat. The city's offering some grants, but what more must be done from a federal and state level to support small businesses and ensure that they don't go bust entirely?
Well, I think, again, I think we're trying to figure this. I think the federal government was trying to figure out what's the best relief coming down. And as far as I saw the first relief package that came down, that was just really kind of the first one of many. I think there's been 3 or 4 different versions of relief coming through the federal government. You know, somebody gave me this idea, a business person said, what we should have done, and maybe still do, is literally stop the economy, meaning the economy keeps moving forward, but okay, anyone that owes a bill or owes credit cards, you stop it right now and you pick it up on the other side. And for a 3-month period, you kind of put things on pause. Now, obviously, pause meaning restaurants are still open and there's still business happening, but loans and mortgages and rents and all of that. And short of doing that, there's going to be billions more coming down from the federal government in relief packages to be able to keep the businesses alive and going after this is all over. I was on a phone call today with some other folks, and they were talking about with the Convention Center Bureau, and they were talking about not being able to make their rent payment, and what happens to my business if I can't, which puts the landlord, whether it's a big real estate person or somebody who owns a building, what happens if they can't pay their rent and they can't pay their property taxes? So I think that we really have to think about on a national economic scale, get a lot of people into a conversation about how do we address our economy? Because as the doctor alluded to, and I'm kind of alluding to, our economy is not going to get back up to full generation probably till several months from now, where we, at least the resemblance of where we were. And I think that for the small businesses, we have resources in the city of Boston. We're asking you to give us a call, but there's no way that the city of Boston will be able to bail out every small business in the city. And we're really going to have to depend on the federal government and the banking industry, quite honestly, to help with what we're going through today.
I'd love to know, do either of you have a message for the president about what you think he can offer the city and what it needs?
I would just ask him for some consistency in his messaging. Let the experts talk about it, what they know. I can't, in good faith, be on this Zoom call today and talk about scientific evidence and data and testing and what the impacts are going to be. I leave it to Dr. Peter Slavin. I leave it to the experts to do that. And I think that we have to really need some consistency out of Washington, whether it's on messaging about what we have to do. And then also, I mean, I've tried not to get involved in the political partisan politics here since we've been in the coronavirus, because people don't need to hear people pointing fingers and yelling at each other about Democrats and Republicans. It's a time for us to come together as a country. So I would suggest the president do the same thing. Let's leave the partisan politics aside and just be a leader right now. That's what the country needs.
Dr. Slavin, want to tackle that one?
He might not want to.
But a month ago, I, along with Senator Marty, called for the president to make use of the Defense Production Act, because it was clear then that we needed a federal organized effort, and we needed to enlist industry in this country fully in the need to produce PPE for healthcare workers, and also the need to expand testing dramatically. I continue to wish that the president would use the full powers under that act and take a more coordinated federal approach to these issues. It doesn't make any sense for hospitals competing against states, competing against the federal government for the same PPE equipment that's available here or around the world. And the testing strategy needs to be coordinated at federal level as well. And we desperately need to expand testing in order for us to be able to see our way out of this crisis in an intelligent and an effective way.
I was going to say, as we think about a return to normalcy, how much does that depend on outside states and outside orders? I know New England is coordinating some of those efforts, but as we look throughout the country, as certain states are already loosening their restrictions, how do we maintain our own safety when those restrictions are going in and out, and what sort of planning is being put in place to ensure that we keep our own safety here as best we can?
I think on a global scale, we need a national conversation going on about how do we open up society nationally. Whether it's tourism in Boston, if there's different rules in different cities and different states around the country, then our tourism industry is not going to get back up and running. We have a lot of interstate trade that goes on. And I think that on a national level, the governors probably are having this conversation amongst each other about how do we open up our country through state lines. I know we're having conversations as mayors doing the same thing, having conversations about how do we open up and how do we work collectively together to share best practices and try and move our economy forward. But at the end of the day, some of the southern states, some of the rules and regulations that they're lifting tomorrow, I believe, that's very dangerous. And you're hearing it now from the mayors in those cities in Georgia, in those states, I should say, in Georgia and other places, really speaking up and being critical of those decisions made by those governors in Florida, another one. Those are dangerous decisions, because if the spike gets worse down there, then it prolongs the agony for the country. When I think about the economy, obviously you think parochial, you think of the Boston economy, but the Boston economy feeds off the Massachusetts economy, which feeds off the Northeastern economy, which feeds off the country's economy, which feeds off the global economy. And right now, most places in this world, we're in the same situation. They're still trying to figure out how to open up Italy. They're still trying to figure out what's going on in China. They're still trying to figure out what's going on in Japan. So I do think that there has to be some coordinated efforts, particularly on big picture items, on how we move forward here.
Dr. Slavin.
I would just add that not only are we interconnected, I would just add to what the mayor just said, that not only are we interconnected economically with places like Georgia, but this virus doesn't obey city or state or international boundaries. If there's a big spike in Georgia as a result of the decision of the governor, that puts us at risk. I mean, this virus all began at a market in Wuhan, China, and look what happened. So any part of any state in this country, any government in the world that doesn't do everything it can to control this virus is not only putting their own citizens at risk, it's putting everyone at greater risk.
Along those lines, a question from a reader, Dr. Slavin, could you talk more about herd immunity, and so that lay people can better understand the concept? This person thinks we should go for it and let people develop a natural immunity rather than wait for a vaccine. How would that work?
Well, I guess there are two. I mean, to achieve herd immunity with a virus like this, you probably need about 60, 70% of the population that's either been exposed directly to the virus or been vaccinated successfully against it. Because when the percentage of the population that's infected gets that high, the virus has a hard time in infecting other people, because when it's spread, more often than not, it's going to try to infect somebody who's already been exposed, and so it doesn't work. The best way to get from where we are now, with just a couple of percentage of our population infected, to herd immunity would be a vaccine, but that doesn't exist, and probably won't exist for at least a year, optimistically. The only other way to do it is for people to get exposed, and in the absence of a drug treatment, an effective drug that will make the symptoms of this disease and the mortality associated with this disease better, I think a lot of people are going to be frightened of pursuing that path. If you look at the deaths within Massachusetts, only 5% of them have occurred among people 59 years and younger. The vast majority of the deaths, 95%, have occurred in people 60 and over. I think 30% among people over the age of 90, another 20%, 80 to 89. So it's really older people who are most vulnerable. And I do think, as we think about opening up society, that it probably will make sense as the White House recommended, for younger, healthier people to start increasing their activities first before we allow older people with comorbidities to do it, because they're just at too much risk.
Another question from readers is about antibody testing and what the availability looks like now, where people could go to find out if they have the antibodies, and you know, even who would pay for that.
Antibody testing is just beginning to roll out now, and I believe there are over 90 different companies that are producing antibodies, some of which seem to be quite good. Some of the tests are somewhat questionable, so there needs to be some sorting out there, and the FDA needs to identify the tests that are really high quality. I think because of the nature of antibody testing, it's going to be a lot easier to scale that up dramatically to millions and millions of tests. The test for the virus itself, the RNA test, is much trickier and harder to ramp up. But using the antibody test to control the virus is a little bit like trying to drive your car by looking in a rearview mirror. It tells you who was infected. It doesn't necessarily tell you who's currently infected and potentially infectious to others. But knowing who's infected and who has antibodies will, again, identify a segment of our population that is probably safe to go about their business. And it will also identify a group of people who are potential individuals who can donate their blood, donate their plasma to people fighting the virus. We're very hopeful that using serum from people who've previously been exposed to the virus may be therapeutic to those who are currently fighting it. That's one of a number of clinical trials that we and others are engaged in. That could be one of the earliest treatments that becomes available.
And another question from readers is about masks. I'm curious, how long do you think that we'll need to wear them out in public? And what do you recommend we say to people who aren't wearing them in public right now?
I think we're going to need to be wearing some sort of personal equipment until, as I said before, transmission down to zero. I think parks or along the street, whether they need to wear a mask is questionable. But if they're in a supermarket, on the T, in relatively close proximity to one another, I think they're doing themselves a service and people who they're near a service by wearing cloth or surgical masks.
You know, when we think about how Massachusetts is uniquely positioned as a center of healthcare and research, you know, where do you see us leading the way in terms of getting out of the virus? I mean, President Obama cited Massachusetts yesterday in a tweet as being a leader here. You know, how do you think we are going to set a precedent here, or be sort of a guide for the rest of the country in terms of our approach to getting to a place where this is behind us? Mayor Walsh.
Let me
that one.
It's going to go right back to Dr. Slavin, but we built a hospital in 5 days here in the convention center. We have Dr. Slavin was a big part of that, and Mass General and Partners Healthcare and BI. We were able to quickly get people being treated there 2 days after it was built. We had healthcare for the homeless, working on our homeless guests that are staying at the convention center. We have 100 of them today. We lead the country. We're fortunate. I'll speak for myself. I am blessed to be mayor of the city of Boston with so many amazing medical institutions. And I think that Boston and our medical institutions are going to lead the way by working on this virus and preparing us as a society for what might come next. And I think that it's certainly going to be at the front of mind when we get through this crisis here, what could be coming down the pike next. I look at the numbers of people that are infected in the city of Boston, 6,500 as of yesterday, 221 deaths. The deaths are lower because of the incredible hospitals we have in our city, and I want to thank them for that.
Dr. Slavin?
I would just agree with what the mayor said. We also were fortunate to have great civic leadership in this community. I think the work the mayor has done and the governor is exemplary of how leaders should, with their people, encourage them to do the kind of physical distancing that is so crucial to saving so many lives. But the other way that this place excels is in its research capacity. Boston does much more research than any other city in the world in terms of biomedical research. We've been leaders in cancer research, cardiac research, and we're clearly have within a few weeks become leaders in research on COVID, both the very basic biology of it, drug development, diagnostics, as well as vaccine development. So I think this is an opportunity for Boston, both through how we respond to this virus from a governmental standpoint, how we treat it clinically, but also how we come up with better answers for the future. This is an opportunity for our community to really shine and make a difference that will not only be felt here, but throughout the world.
Thank you both. I'd just love to open it up to you both and give you the opportunity to share any closing remarks or thoughts with the audience. And thank you to all of you who've stuck around through this too.
Let me thank you, Janelle, for moderating. It's a great conversation. I want to thank Dr. Slavin for his leadership in our city. He's an amazing human being. I want to thank the Boston Globe and Brian McGrory. I want to thank Roger Crandall and Mass Mutual, not just for sponsoring this, but for your offer to first responders. That is absolutely amazing, the life insurance offer there, Roger, and thank you for that as well. And to the residents of Boston and people watching this today, we're going to get through this. We're strong, resilient people. We've been knocked down before. We get back up. And one thing I do think we have to do is just look out for each other, take care of each other, and one day at a time, we will get through the other side of this. So thank you.
Thank you, Mr. Mayor. Dr. Slavin?
Yeah, and Janelle, I just would like to return the favor to the mayor. We had the pleasure of getting to know him since he took office. His leadership on healthcare issues in this city has been amazing, and what he's done since this crisis has developed is truly remarkable. Janelle, I want to thank you for your great moderating skills. I want to thank the Globe for hosting this session and for doing such terrific reporting on this subject over the last few months. And thank our colleagues at Mass Mutual for generously supporting this program as well as offer to our healthcare workers.
And I just want to reiterate a big thanks to our readers who have joined us here, and also to all the essential workers who have been supporting us throughout all of this. So thank you. We are all much safer because of you. And thank you all for joining us. We'll have this posted online shortly, and we look forward to further conversations. Thank you so much.
So what a great discussion this afternoon. I really want to add my thanks to the mayor and Dr. Slavin. I know I come away from this very encouraged, hearing that we have leadership that is actually looking at what's happening and saying, let's use data to make the right decisions. Let's use the great research capabilities of our city and the Commonwealth. And Janelle, thank you very much for moderating this as well. You know, Mass Mutual has called Massachusetts home since 1851. From Springfield. We're now in Boston as well. And please, if you're a healthcare worker in Massachusetts or Connecticut, go to massmutual.com and please get your free life insurance policy. So thank you very much to the Globe. Thank you, everybody. And please, we're looking forward to brighter days ahead for everybody. Thank you very much. Thank you.